Hi, this is Dr. G, your Arthur guy. Today I'm going to try to explain to you how robotic or specifically Mako total knee replacement works. In previous episode, I described to you why I do robotic or Mako total knee replacement. In today's episode, I'm going to go into more details in how I go about doing these cases by giving an example. I want to emphasize that Mako total knee replacement is not automatic. I have to put a lot of inputs. Without further ado, I'm going to go over the example with you. This is a patient who had bone-on-bone arthritis and failed conservative management. She failed the physical therapy, she failed getting injections, and she suffered for many years before going ahead with the surgery. We talked about manual versus robotic knee replacement, and she wanted to go ahead with Mako total knee replacement. Prior to surgery, it is essential to get CT scan of the knee. CT scan is required because this information is used for planning and execution of Mako total knee replacement. Weeks before the surgery, all the information from the CT scan gets registered, and my MPS, Mako product specialist, looks through the images and plan accordingly. And then I go over with her or him in terms of what size of implants we're going to use and where these implants are going to be positioned generally, and if there are any surprises prior to going ahead with the surgeries. As you can see in these images, we get a 3D images, and we can accurately predict what size of implants we're going to put, and rarely we change the size of these implants. During the surgery, what is different from regular knee replacement or manual knee replacement is that in robotic knee replacement, I have to put pins into the shin bone and as well as into the thigh bones. So I have to make additional incisions for this. The reason why I put these pins in the bones because the robotic camera has to see where the bone is. Basically, I put antennas onto the bones so the camera can see it. So once those are placed in, it needs to be going through multiple registration points so that the bones gets clearer as we go through this process. We try to find the center of the rotation of the hip, of the ankle, and there are going to be a bunch of points that I'm going to register onto the bone itself. There are 40 points on the thigh bone and 40 points on the tibia bone. Once all those points are done, then we can get a very accurate picture of the bone, and so that we can execute them. The next stage we do is probably the most important part of the surgery. This is a part where I adjust where the implants go depending on the ligament balancing. So what this image shows is that when I'm tensioning it, it gives the gap about 2.5, 3 millimeters gaps in between inside and outside. Based on the images or based on the planning that I had where the implant's going to go even before the surgery. So my job is to try to bring it down to zero. Zero is a well-balanced knee. And the reason why we need to have a balanced knee is so that we can have a better range of motion and you can have a stability and less pain in your knee. So once that is all registered, now we're ready to execute. We bring the robotic arm to the field. When it gets into the field, it finds the plane where the cut is going to be and start cutting it once I push the button, and I got to drive this assault. As you can see in this image, that there is boundary around where the cut is going to be, and the robotic arm would not go further than that. So there is accuracy of the cut in terms of the plane of the cut and how far the cut is going to be. So there is going to be less injury to nearby structure, such as a soft tissue. We make a one cut and we make more different planes of a cut in order to get the metal caps to go onto the thigh bone and onto the shin bone. So I'm going ahead and carry on with multiple cuts. As you can see, different areas of a cut on the thigh bone, going through this. This is the exact speed that I'm going through the surgery. Once cuts are done, then I put trial implants in and making sure that I do have a well-balanced knee as I planned it accordingly before the surgery and as I adjusted throughout the surgery. Once I'm satisfied with these trials, then I take everything out and put the real implants in. The patient that you saw in the x-ray who had bone-on-bone arthritis have real implants in here from the front and side view. So there you have it. That's how I go with step-by-step doing the surgery. And I also wanted to show you how well patients do after the surgery. This is a patient who had knee replacement using Mako robotic arm assisted technology 10 days ago.
I've lived with this awful knee that needed a meniscus repair last year on my birthday in June. And this year in December, I fell and re-injured the knee again. Went in to see Dr. G, and he recommended a full knee replacement. And I was quite apprehensive. I didn't think that I really wanted this done. But at the same time, I was afraid if I didn't do it now, I might not be in condition to do it later. So we made the decision to go ahead with it, and I was treated like a queen in the surgery center. And I went home the next day, and by Thursday, after my surgery day, Monday morning surgery, I was out walking in the grass around my house using the walker with my PT evaluator. And today it is, 8 days post-surgery?
I think it's 10 days.
10 days post-surgery. And I have full range of motion for my knee, and I feel fantastic.
Wonderful.
So,
can I see you walk?
Yes, best treats.
Okay, wonderful.
Remember, heel toe, Gene.
Yes, yes. You can have a seat now.
I'm so happy.
Her incisions have healed nicely. And as you can see, there are 2 poke hole incisions that are made for pins that are placed in the shin bone, so I can put an antenna on it. Her swelling is not too bad. It seemed like there was a very little injury to her soft tissue, and her range of motion was excellent. She was able to get 120-degree range of motion, and she's walking very well without any limp. And I can show you another patient who had bilateral knee replacement using Mako technology, and he was walking 1 week after the surgery. And finally, another patient who had both knees done 2 weeks after the surgery. He had excellent range of motion and very little pain, not using a lot of narcotics. 2 weeks after bilateral knee replacement. He's walking well without any assistive device. Come back. All right. Look, you have it. This is how I do Mako total knee replacement. If you have any questions or concerns, please leave in the comment section, and please subscribe and watch other videos on my YouTube channel. Thank you very much. Take care. Bye-bye.